Hi everyone, Ron Crider reporting for duty again today. It is Thursday, February the 4th. It's about 8:12 in the morning when I'm putting this first little piece together. And I'm going to continue with putting these little videos up for you that I have edited because they are pretty important. They're really good. They give you some great information and they can do it a whole lot better than I can. By the way, if you didn't get an appointment on Wednesday, Publix said it will be reopening its vaccination registration at 7 a.m. tomorrow. Now, if you're watching this, it's tomorrow morning. You might be a little late because it's 7 a.m. Tomorrow morning, Friday morning. Remember this, write this down. Friday morning, 7 a.m. Be there to see if you can get on that vaccination schedule and stay there. Don't move away. Just stay there in the queue until they take you because they'll probably start out with several hundred, maybe 400, 500, 600 available vaccinations for our area, for our county. So you better try that. By the way, Walmart will be offering vaccinations, but currently not in Indian River County. So that's a government deal. The government is passing out the vaccines to Walmart stores and CVS and everybody else, but not here in Vero Beach yet. I'll let you know when that happens. By the way, tomorrow morning, it's going to be 10 degrees warmer than it was this morning. This morning, it was like 32 degrees, freezing here in Vero Beach. By the way, the temperature today on Thursday is going to be much warmer than it was yesterday. And as I said, tomorrow it will be about 10 degrees warmer as well. So as I said, I've edited some of these videos for you that I have picked up, these little news pieces. The first one I'm going to show you here has to do with how these vaccines are currently working all around the United States. The second one will be on the Johnson & Johnson new vaccine that's coming on the market. And the third one will be on the current mutation of the virus and how the vaccines react to that. They're all three pretty good. They're about 10 minutes long. The numbers will come up immediately following that. If you don't want to watch these, you can skip these and move straight on to the numbers. Thank you again for watching, and don't forget to push the like button. I sure would appreciate that. Have a great day. Here we go.
It has been more than 50 days since the first COVID-19 vaccine went into an American's arm outside of a clinical trial. But what do we know so far about how the vaccines are working, and are they beginning to contain the pandemic? Bob Woodruff has this week's Vaccine Watch.
With new, more contagious COVID-19 variants now spreading across the globe, in America, about 27 million adults have had at least one vaccine shot. That's about 8% of the U.S. population. And some communities may already be seeing the benefits. In Los Angeles, the county fire department says new COVID cases dropped dramatically after the vast majority of staff got the vaccine.
The most exciting thing is that the number of new cases that we've seen in the department since we adopted the vaccine has plummeted. And virtually all of them now are in people who declined the vaccine.
What are the numbers?
In the last week, we've had 11 new cases. 10 of the 11 were in people who declined the vaccine.
U.S. nursing homes are also seeing a drop in new cases, where roughly 78% of residents have received at least one dose. Nationwide, the country is finally seeing a decline in COVID hospitalizations as well. Experts say that's due to a combination of factors, including vaccinations, stay-at-home orders, masks, and social distancing, and because people who have recently recovered from COVID have some immunity.
Number one is we're starting to vaccinate people. Secondly, it's, when we say that roughly 26 million people have been infected in this country, that figure is off probably by a factor of at least 3, which means that at least 20% and possibly as many as 30% of people in this country have already been infected. And if that's true, you can consider them as being roughly immunized.
While the U.S. has moved slowly to vaccinate everyone, Israel has moved remarkably fast.
Israel has a centralized healthcare system. On some days here in Israel, we vaccinated 250,000 people.
According to Dr. Eran Segal, an Israeli computational biologist, more than half of Israelis have had at least one shot already, and that is leading to dramatic declines in hospitalizations among people older than 60.
So even though the magic has started, make sure you continue to be cautious.
Yeah, exactly. So that's why we said we say this with caution. The magic has started, but yeah.
Do you think the magic will continue to grow?
I really hope so.
Yet the U.S. is still nowhere near herd immunity, which is when enough of us are vaccinated so that the virus has nowhere to spread. Experts say we need between 70 to 90% of the population to be vaccinated to achieve it.
We're still in the single digits. We are nowhere near that level. So we've got to do much better, and we can't leave any community behind.
While vaccinations are already proven to be effective, there are those who remain hesitant.
There was pessimism? What do you mean there were there were doubters?
I wouldn't say pessimism. I'd say skepticism.
So even within the fire department, you saw there was skepticism in the point where there's misinformation that they were buying into, that these vaccines may be too dangerous to take?
Well, the fire department is made up of healthcare professionals and EMTs and paramedics, but it's also a cross-section of society. When you look at large healthcare organizations, even they had a fairly significant subset of people who declined the vaccine. And they declined the vaccine because they fall victim to the misinformation campaigns, just like everybody else can.
Another challenge, getting the vaccine to low-income communities, many of which happen to be those hardest hit by the pandemic.
We can't just have one segment of this population getting vaccinated, A, because we will not achieve herd immunity, but B, it's going to leave the most vulnerable populations behind.
While there are new concerns about new COVID variants, there are other positive signs ahead. For the first time, the number of people who have received at least one shot of the vaccine surpassed the number of reported COVID cases to date.
You should be pretty proud of what you've been able to accomplish on this.
I'm super proud. I have an amazing team.
Bob Woodruff, tracking the vaccine.
This morning, another shot of hope for a nation desperate for an end to the pandemic. Johnson & Johnson saying their vaccine, which requires only one shot, is 72% effective at preventing COVID in the U.S. and 85% effective against severe symptoms. That's less than Pfizer and Moderna's, but Johnson & Johnson says no one who received their vaccine went to the hospital or died. Dr. Fauci reacting with NBC News' Lester Holt.
This is actually good news. It's value added to the whole effort of getting more vaccine candidates into the mix.
Welcome news for health experts who fear the South African variant is already spreading in the community after 2 separate cases were detected in South Carolina.
Obviously, it's scary, right? Any infectious disease is terrifying.
But Johnson & Johnson says its vaccine is 57% effective against that strain.
The important point is that the protection against severe disease was very high, even in South Africa, where the mutant is dominant.
This as states from coast to coast are easing restrictions. New York City on track to resume indoor dining at 25%, and wedding receptions can resume at half capacity.
Promise of marital bliss is returning.
And in hard-hit California, restaurants are now back open for outdoor dining. Nail and hair salons can operate too. But real normalcy will come with vaccinations. In Seattle, hundreds of seniors scrambled in the middle of the night after a freezer failure meant 1,600 doses had to be administered before dawn.
My wife came screaming down the stairs saying, "Did you see the news?"
Not a single drop went to waste. Pure excitement to get a dose of freedom that much of the nation is still waiting for. And it's important to remember that even after you get the vaccine, you still do need to practice social distancing and wear a mask. In fact, the CDC announcing on Friday that masks will be required on all public transportation. So we're talking planes, trains, boats, buses. That all starts on Monday. Peter and Kristen?
All important reminders there. Megan Fitzgerald, thank you for that. And now to the latest on the pandemic. COVID cases and hospitalizations are dropping sharply across the country as more than 1 million Americans have been vaccinated daily for the last 12 days. But concerns are growing over new virus variants. Dr. Anthony Fauci says they should be our top concern in the U.S. and that the next 6 weeks will be critical in preventing their spread. So will current vaccines protect against these new mutations? Let's bring in Dr. Drew Weissman. He's a professor of medicine at the University of Pennsylvania who developed the mRNA vaccine platform used by the Pfizer and Moderna vaccine. Dr. Weissman, good morning. Thank you, or good afternoon, I should say. Thank you for being here. When it comes to trying to adjust for these new variants, how feasible is it to manipulate the current vaccines if you find they don't protect as well against these new mutations?
So we're not at that point yet. The vaccines still work. The worry is that they soon, or in the future, they may not. For the RNA vaccine, it's very simple. You simply exchange a new antigen, a new spike protein in the mRNA, and produce it. According to Ugur Sahin, the CEO of BioNTech, that will take them 6 weeks before it'll be ready to give to patients. So that's incredibly quick.
So it's easier, it sounds like, to manipulate the mRNA vaccines, this new version of vaccines, than it would be to do the same with if these vaccines were done in a more traditional format?
It would, because making the RNA is quick and it's simple. Whereas these other platforms would require more optimization, more testing, more development.
And so what kind of work is being done right now to try to make sure that these vaccines continue to be effective?
So I know that both Moderna and BioNTech Pfizer are already working on a potential booster vaccine that will cover the South Africa and other variants.
Now, we have already seen some hiccups in vaccine distribution and administration here in the U.S. So is vaccine distribution infrastructure prepared to administer not only the initial versions of the vaccine, but then also any future booster shots we might need?
So that's actually a good question. We're certainly improving. The amount of vaccine, the ability to distribute it, to give it to patients is improving from week to week. And I believe it's going to continue to improve.
Now, a peer-reviewed study released today found that Russia's vaccine is over 91% effective. Could we start to see that vaccine used here in the U.S.?
I mean, that's great for a vaccine efficacy. I don't know where the Russians are going to distribute it.
All right. And lastly, Dr. Weissman, we know that there is a lot of mistrust in vaccines in general, particularly these, because it's a new virus and a new vaccine. But one of the concerns is that the mRNA platform itself is new, and that has people worried. What do you say to people who worry about that aspect of the vaccine?
So it's not new technology. We've been working on mRNA for 30 years. We've been working on mRNA vaccines that are essentially identical to the COVID vaccines for about the past 9 or 10 years. They've been in people for over 6 years. This is not a brand new vaccine. It's well-established technology. The vaccine has been shown to be incredibly safe and very, very effective.
All right, Dr. Drew Weissman from UPenn, we appreciate your time and your work. Thank you.
Thank you.
Hi, everyone. Ron Crider here in the numbers department again today. And today is, of course, February the 4th. It's Thursday. And big, huge numbers. Not a good day. Everything is up today. You're not going to like these numbers at all. 226 new deaths in the entire state of Florida, although there are some other states that have worse deaths than we do, but 226 is a lot of deaths. That's up from 28 from yesterday. Yesterday we had 198. 7,711 new positives for the entire state of Florida. That's 732 more than yesterday. Yesterday we had 6,979. Now, the vaccinations today for the entire state of Florida for the past 24 hours, 73,113. Sounds like a lot, and I wasn't one of the people who did get vaccinated. By the way, I need to remind you, of course, don't forget this, tomorrow morning, 7 a.m. in the morning, you don't have to get up at the early hours, but 7 a.m. you need to be in that Publix site and see if you can get yourself a scheduled vaccination at one of the Publix stores. 7 a.m. tomorrow morning, and don't forget, stay on the site. Don't come and go and come and go and come and go, because you'll be going in and out of the queue, all right? Miami-Dade yesterday, 23 new deaths to report, 1,447 new positives, 2,972 new vaccinations for Miami-Dade. In Brevard County, 14 new deaths to report in the past 24 hours, 838 new positives, 2,043 new vaccinations in Brevard County. That's Fort Lauderdale. In Palm Beach County, 26 new deaths to report in the past 24 hours, 634 new positives, and Palm Beach vaccinated 5,231 folks. Now we'll go to Orange County. That's Orlando. 8 new deaths to report, 368 new positives, and up in Orlando, they vaccinated 2,375. Alrighty, folks, here we are in Brevard County. No new deaths. Good deal. No new deaths up in Brevard County. That is Melbourne. 127 new positives and 1,988 vaccinations up there in the Melbourne area. St. Lucie County is Fort Pierce. 4 new deaths to report, 141 new positives, 757 new vaccinations in St. Lucie County in the Fort Pierce area. Martin County is Stewart. 13 new deaths to report, 43 new positives, and 583 new vaccinations in Martin County in the Stewart area. Indian River County is Vero Beach. That's where we are. Indian River County, 0 new deaths to report. In the past 24 hours, 47 new positives and 466 new vaccinations. Not very many because the reason is they don't have any vaccine to put into those syringes to give you your vaccination. So they're really running very short. So hopefully tomorrow we're going to get a new supply. Alrighty, folks, here we are in Indian River County. Again, I'm going to give you the zip codes for Indian River County, 32948. 2 new positives. All of these are new positives in the past 24 hours. Zip code 32958. 11 new positives, zip code 32960, 7 new positives, zip code 32962, 6 new positives. Here in the Barrier Island, zip code 32963, 6 new positives, zip code 32966, 4 new positives, and zip code 32967, 5, and zip code 32968, 6 new positives. I'm going to take you down here and show you the 7-day moving averages for the deaths for the entire state of Florida, and that would be 174.86. Yesterday it was 171.14. That's the number of people who passed away, the 174 number, the number of people who passed away each day for the past 7 days as a result of COVID-19 for the entire state of Florida. All right, here are the Bloomberg numbers for the states of the United States, the ones that we're reporting on. First, I'll give you this big number. So far, the United States has administered 34,993,201 doses of the vaccine to the people here in the United States. In the past 24 hours, 1,335,310. Texas administered 96,932. California administered 151,791. Florida administered 73,113. I told you that earlier, just a minute ago up there. Rhode Island, 3,250 new vaccinations in Colorado. Colorado did 20,371. Wisconsin, 32,001. Minnesota, 29,494. In Jersey, 29,873. New York, 52,891. In New York City, 23,412. So those are the number of new vaccinations that were given out in those states. I'm going to show you the past 48 hours, the number of deaths in the entire United States. This is 48 hours ago. 4,005 for the entire United States. Texas was 426. Look at California, 587 48 hours ago. Florida was 198. Rhode Island was 12. Colorado was 14. Wisconsin 14. Minnesota 64. Then we'll get down here to New Jersey, 109, and New York was 209. In the past 24 hours, New York was 127. Jersey was 100 deaths in the past 24 hours. Minnesota was 17, and Wisconsin was 41. And then we'll go up here just a little bit further, and Florida was 226 24 hours ago. One more stopping off place here. These are the big numbers, the global numbers. USA cases since we started with COVID-19, 26,633,017. Total number of deaths in the entire United States, 454,272. Total USA deaths since we started, 454,272. These global cases we don't talk much about, but it is 104 million, over 104 million, a huge number, almost impossible to imagine. Those are the people who contracted COVID-19 in the entire world. And then as far as the people who passed away in the entire world, 2,277,821. Alrighty, folks, so those are the numbers for today, for Thursday. Not a good day, definitely a good day. Oh, my goodness gracious. And I hope this Super Bowl thing doesn't drive them up again in the next 10 days. So really do what we tell you every day. Please, please, please. Mask up, distance space. Don't go out if you don't have to. Don't go out and hang out at bars. Come on. You can do the right thing. Ron Crider signing off for today. Thank you very much for watching this video. I appreciate it very much. Hit the like button if you haven't done so already. I sure do appreciate it. And I hope you have a very blessed rest of your Thursday. I'll see you back here on Friday.